Hi guys and dolls, how are you today? So I'm in the cyber cafe where I normally come and study because as some of you know, I'm a psychology major. Anyways. So today we are going to be talking about panic attacks. I have been wanting to talk about panic attacks for a while. Some of the style of my videos, sometimes I talk more I talk about something more personal. Sometimes I talk about it more from a clinical perspective, unbiased perspective, or, objective, should I say, perspective. So right now I'm just going to be talking about more about the clinical stuff. However, I probably will do a video later on about like my story, my personal story with panic attacks. I actually really don't have panic attack. I don't even remember the last time I had a panic attack, probably like a year or something ago, and I can talk to you guys about how I went from having lots of panic attacks and pretty much having none. But today I'm going to be talking about this worksheet that you can find at therapistaid.com. I have it up on my computer screen. I also have it right here. So you can download that and have it for your resource folder or whatever. So it says, what are panic attacks? Panic attacks are brief periods of overwhelming fear or anxiety. The intensity of a panic attack goes well beyond normal anxiety and can include a number of physical symptoms. During panic attacks, people often fear that they are having a heart attack, they cannot breathe, or that they are dying. Something that they did not add that's related to that, it's like this feeling of impending doom, kind of like something's about to happen and you don't know what's going on, but you feel like something's going to happen. So it says symptoms of a panic attack. A panic attack does not need to include all of these symptoms listed below. Okay, so pounding or racing heartbeat, sweating, trembling or shaking, fear of going crazy, feeling of being detached from reality, breathing difficulty, sense of terror or impending doom or death, chest pain or discomfort, nausea, fear of dying. I personally haven't had all those. My main ones are like my heart feels like it's gonna fly out of my chest, sweating. I remember when I first had my panic attack, I was cold and I was sweating profusely. So I had like chills and I had like it was weird. So that's how you know it's like biological response. I had nausea, I had chest pain too, and I felt like I couldn't breathe, and I felt like something terrible was about to happen. Not a good feeling anyone wants to feel. Panic attack facts. Panic attacks may feel scary, but they don't actually cause physical harm. The most common fears associated with panic attacks, having a heart attack or fainting, are not actually a threat. Okay, so panic attacks are usually brief but intense. The symptoms of panic attacks peak within 10 minutes and end within 30 minutes. However, some lingering symptoms can last over an hour. Panic attacks can seem to occur randomly, or they can be closely linked to a specific source of anxiety, such as driving, crowded places, or simply leaving home. I think the one simply leaving home is called agoraphobia. However, you can have agoraphobia with panic attacks or without panic attacks. Before, I think in like the old DSM, it was you had to have panic attacks, and I think in the updated DSM-5 or whatever, don't quote me on that, I think you have to. You don't have to have panic attacks with agoraphobia. Okay. So panic disorder occurs when a person has frequent worry or fear of future panic attacks, or when they change their behavior into avoid attacks, such as avoiding a feared situation. I have experienced this. However, I do not have panic disorder. Out of the 3 anxiety disorders I have, panic disorder is not one of them. Yay. I have had that experience after a couple of panic attacks, not wanting to go back to that place out of fear that those symptoms would arise again. However, with panic disorder, it's more you don't go back at all and you avoid them, and you kind of continue to do that. It's more than a once or twice kind of thing. It's like an everyday thing or a weekly thing. Something that really causes disruption within your routine. Because if you have a panic attack of going to your classroom, you start if you have fear of having those symptoms again, you're most likely going to avoid going back to class. So how are panic attacks treated? So we have 4 right here. We have CBT, cognitive behavioral therapy. What is CBT? It's common and well-supported treatment for panic attacks and panic disorder. Works by identifying and changing unhealthy thinking patterns that trigger panic attacks, and the benefits can be long-lasting. CBT is not just for panic attacks or panic disorder. CBT can be used for any kind of anxiety or depression, or I think mental illness, because if you change your thoughts, you can kind of change the way you feel. If you change the way you feel, you can change your behavior. So I love CBT. I do that now, and it's great. Been doing it for a long time. Exposure therapy, another one of my favorites. The patient is intentionally exposed to the symptoms of panic in a safe environment. As exposure continues, the symptoms become more familiar and less terrifying. Exposure therapy may also involve gradual exposure to fear situations. I've done exposure therapy by myself or with friends. You do not need a therapist. My therapist could not be with me at times when I felt like I needed to face my fears. So I went on and I did it because I have courage, and I really like to overcome challenges. And there are things that I feared from going into different school offices at my school. I don't know why. The guidance office freaked me out in 9th grade, and I'm in there every day, all day, pretty much my senior year. So it's like I went from only going there a few times a year to being there every day, a few times a day. So also with my OCD, I do a lot of exposure therapy. I can talk about that in a different video. Medication. Medication for panic attacks can act as a short-term treatment for severe cases. Because medication does not treat the underlying issues that cause panic disorders, it should be accompanied by another form of treatment such as psychotherapy. Psychotherapy and medication, best combination if you suffer from any kind of mental illness. You do not just want to do medication only, because you're not going to treat the underlying condition if there's that component that is a component that could be solved through, or a component that is learned, learned behavior, having to unlearn. A lot of anxiety is learned. You learn it through maybe one of your parents have anxiety, and when you're younger, you kind of learned it from them. I know I kind of did. Anxiety is often genetic. Makes sense. That's not their fault. That's not your fault. It's just simply genetics, biology, psychology. But for panic attacks normally are treated by benzodiazepines, which can be highly addictive and not really solve the problem. Or it might solve the problem, but then you're going to need another one, or you're going to need a higher dose because maybe it's not as effective. So I would honestly start off with just therapy, because that could just help alone, unless you feel like you really, really need it. And some people do, and that's okay. Some people can't leave their house without taking their medicine, or drive without taking their medicine. So I'm not putting down medicine at all, but I'm saying that shouldn't be your go-to. Next is relaxation techniques. Much like muscles become stronger with exercise, the body's relaxation response can be improved with practice. Frequent use of relaxation techniques such as deep breathing, meditation, and progressive muscle relaxation can help to combat panic attacks. Breathing so helps, because your heart is racing, your whole flight or fight response is activated. You are physically aroused through your autonomic nervous system. Okay? So what happens in your brain? Now I'm going to kind of go more into the neuroscience, because I like neuroscience. You have this part of your brain called the amygdala. And the amygdala, that's what controls your fear. It's kind of like the center for your fear, and it's really small. And that is what controls your emotions and your anxiety and all that. And so some people have what they call a overstimulated, overactive amygdala, which is why some people have anxiety. However, I don't know if there's much research done on that. But my point is, so when that happens, and then cortisol is released from your adrenal glands, which are near your kidneys. So cortisol is released. That's what starts, all those flight or fight responses. And you feel like you need to, basically you're in you feel like you're in danger mode, and you feel like you need to protect yourself. So yeah, breathing really helps with that. Even if you don't think it will, try. It doesn't hurt. And I think that is all. Let me see if it came with a second. Okay, no, that is all. I think they have another one on panic assessment. Okay, the one I'm looking at right now is just a panic assessment that talks about what you were thinking about before your most recent panic attack, how you were feeling before your most recent panic attack, and what you were doing, and circle the symptoms that you have. Are you worried about having another panic attack? How would you rate the discomfort caused by your panic attack? Have you changed your behavior because of your past panic attacks? This would be good to bring to your therapist or your psychiatrist. I personally like to give them stuff like that because sometimes I can't always say it in words, and these kind of help. Or I draw it in like pictures, or I do poems. Like, you don't always, when you go to your therapist or psychiatrist, you don't always have to be like, these are my symptoms, you know? You don't have to be like that, or like act like you're reading out of a textbook. You can express yourself, whether it's through music, whether it's through art, through poetry, through whatever, and your clinician should be okay with that, because that's how they're best going to help you. If you cannot explain necessarily what you need from them or how you're feeling, they're not going to be able to help you as best as they can. So do whatever works, because everyone's different and everyone has different ways of expression, so that's okay. But maybe I'll talk about this panic assessment in a different video. I kind of briefly just explained it. Pretty much goes along with this paper right here. So if you want to download those two resources, again, it's on therapistaid.com. I'll try to leave it in the link below, or the description box below. But that's pretty much it. I probably will end up telling you my stories about panic attacks sooner or later. Right now, I'm really, really super busy with life. And so I'm just happy to make this video because I felt like I haven't made like a really like a informative, should I say, really informative video in a while, and this has been on my to-do list for like months, probably a year. So finally happy to do it, and I really hope this video helps you. Please leave any feedback down below, subscribe, like, comment, follow me on Facebook at Keep Talking About Mental Health. I also have a website, try to link it below, and let me know if you have any questions. But always remember that you're more beautiful than you think, you're more talented than you know, and you're more loved than you can possibly imagine, okay? You can do anything. You can do anything, even with anxiety. Trust me, I've been there, done that. And you really build a lot of courage, strength, and confidence with overcoming your fears and overcoming and overcoming different challenges. All right, so you guys have a great day and do something you're proud of.